Hello, everyone. My name is Dr. Fergal Armstrong, and welcome to Cracking Addiction. And today we have with us Dr. Laura Petracek. So, Laura, today we'll discuss the ninth step. So, what is the ninth step?
The ninth step is make direct amends to such people wherever possible, except when to do so would injure them or others.
It's the making amends step. It's the actually going to visit people to say, I'm sorry I screwed up. What can I do to make amends? Very challenging. And I would imagine it's a long, protracted process. It's not a one off.
No, it's not a one-off. It's having the readiness and willingness to take full responsibility and the consequences of our actions, and
Yeah.
to care for the well-being of others at the same time is the very spirit of step 9.
To such people, what does to such people mean?
Well, to such people are the people that you're making amends to. Those are the quote unquote such people.
The disclaimer, unless it would injure them or others. What if it injures the person trying to make the amends?
That's a good question. Well, I think at this point, the program really is trying to, most alcoholics and addicts are all about me, me, me. And so the program is about really being more aware of other people, our effects on other people, our
Hmm.
behavior, how it affects them. So that is something to take into consideration. But in this step, we're putting other people first, so to speak, like, oh, okay, I really messed up here. I need to make an amends. Let's
Hmm.
say it's something at a job where you embezzled money or something. Um, yeah, that's going to affect you probably negatively. Uh, and but still, the amends, you messed up there, made a mistake, and you need to rectify that.
So yeah, I mean, let's talk about that example. Let's say because of my alcohol use disorder, I embezzled money, and I'm at risk of incarceration or criminal charges. Were I to go back to someone to say, "Here I am to make amends," what's the ethics behind that?
Well, it's something to discuss, I think, with your sponsor, and if you're in therapy, with your therapist, to kind of weigh it out, the consequences.
Yeah.
And yes, it would harm the person, probably, not necessarily, but it might harm them. And then, are they ready to take the consequences? Or let's say they have a family and, a spouse, and they're dependent on this person's income. Would
Hmm.
that be really uh, helpful if he makes an amends or she makes an amends and then there's not an income coming in and it hurts other people?
Yeah.
Probably not a good idea. Um, a
Hmm.
lot of people. So when I was, in the midst of my alcohol and drug use disorder, uh, I stole left and right from department store, anywhere and everywhere. And my sponsor suggested, instead of going there and telling them and possible legal consequences, to just send money every month to all these different places. So that's what I did. And then I read a story once where someone who worked at this particular department store said they received thousands of dollars every month with the ninth step on top of the paper where the money was wrapped in. So, it's I guess, a common way to rectify the situation without harming yourself.
So really, it's making amends anonymously.
Yes, that's it. That's the word I was looking
Right.
for. Yeah,
Right. Right.
yeah.
Okay. Now, that's on one level that's challenging in and of itself. But I mean, the thing that that people might find even more challenging is having to right a personal wrong, going to someone that they know they've hurt, and then saying sorry and asking how to make amends on a very personal level. I mean, there's two steps. First of all, is having to have permission to actually approach the other person, and then also having to ask permission to make those amends. I mean, what would you comment on that?
Well, it's not necessarily two steps or a two-step process. It's mainly making direct amends. So let's see, I'm making amends to someone we had a falling out in a friendship. Um, I wouldn't then take the next step, meaning what could I do to fix it or what could I do to rectify it? That's not really part of the step. The step is about making amends, but it's not about fixing it or the situation. Although that could
Right.
be part of it where you ask, what could I do? But that's really not part of step 9. It's more making the amends and then that's it. And, that could be a conversation or it could not be. Um,
Hmm.
Sometimes I remember asking a sponsor, well, I need to make amends, I want to make amends to this person, but I don't want to rekindle the friendship. And she said, well, you don't have to. You just make amends and then leave it at that. You don't have to say how you want to rectify it because you don't want to re-engage with this person. So I was like, oh, good. I don't want to. So, and she said that's not part of the 9th step is how to fix it. It's to make amends.
So there's a difference between making amends and fixing and rectifying. I didn't know that. I thought they were quasi synonymous, rectifying and making amends.
No, they're totally different.
Right.
Totally different process, different aspects. Yeah.
All right. So can you explain that difference more then?
Well, the difference is, here's an example that I've heard a lot and I've done myself is in the steps of AA or in the rooms of AA, they talk about making a living amends. So meaning, alcoholics or people with alcohol use disorder, mess up a lot and then say, I'm sorry, I'll never do it again. And then the next day they mess up again. And then they do. So a lot of times people that were saying, please forgive me, I messed up. They're like, well, I don't really trust you, dude, because, you messed up so many other times. So they call it a living amends, meaning people will see by our behavior change that we really are sincere and have made the amends. Whereas, our words didn't really, towards the end of our addiction or even in the middle of it, carry much weight because our behavior we'd relapse or use the next day or the next hour. So the living amends is a way to build trust because now we're going to, we're saying, I'm going to behave differently. I'm not going to pick up a drink or a drug, and I'm not going to, maybe speak to you in a disrespectful way or something like that. So that's more of the rectifying part is changing our behavior. And then people seeing, oh, like a lot of clients I work with, it usually takes their family like a year or 2 years before they trust them again. So they said,
Hmm.
Dr. P, they say they're sorry every other minute. What is that? Their word doesn't mean anything. I said, okay, well, what about, they make a living amends and by their behavior, by not picking up their drink or drug, they're showing that they really are indeed sorry, um, that they feel badly. And they're like, okay. But so that trust takes a long time because, again, alcoholics and addicts have a history of saying, I'm sorry, and then the next day going out and doing the same thing.
Right.
So people
Right.
trust them. Yeah.
So I suppose really it's the demonstration of internal cognitive changes by a consistent change in behavior.
Right. It's definitely a consistent change of their behavior, like every day, okay,
Yeah.
I'm going to
Yeah.
follow these uh,
Yeah.
aspects of the program.
And
And
you've said it takes 2 years to get, for families to trust patients or people experiencing alcohol use disorder to let them back in.
Yeah, it takes a long time. I mean, maybe it's only a year, but also being in the sister program, Al-Anon, I hear that a lot, or with families I work with, well, he's gotten sober before, or she's gotten sober or clean before, and then look what happened the next day, or the
Hmm.
next week, or maybe the next month. I'm working with this one couple where, unfortunately, she relapses it like every other week or something, and he's just kind of fed up. And so, Dr. P, I mean, how can I trust her? She says she's sorry, and then 2 days later, she's drinking again. And so,
Yeah.
I mean, he has a point, but yet she's very sincere. She means, I don't doubt that she means what she says, or wants to do to stay sober.
Hmm.
But, alcoholism is such an insidious disease that uh, even though you make the commitment to stay sober, it seems to take over sometimes a person's
Well,
behavior.
that's the definition of addiction, isn't it? Even though you don't want to, you do.
Right.
Yeah. Why do we have to do this? What is the impact of this step on our recovery? I mean, why can't you just pretend this doesn't happen? What's the benefit? I know there's a lot of benefit potentially to other people, but what's the benefit to the person going through this, going through the steps?
I think the main thing is like to wipe our slate clean, to, a lot of people in recovery are carrying a lot of guilt and shame. And it's just like this cloud hanging over us, and, hunching your shoulders. And it's kind of a way to regain your self-esteem, to, kind of hold your head high, hold your shoulders back again, and feel in congruence that your actions and beliefs are matching your behavior, and that this is, that you are a person of integrity, even though when you were in your addiction, you didn't behave in that way. So it's
Right.
mainly to, well, not mainly, but it also really helps the person regain their self esteem and be able to look someone in the eye again, instead of, out of the shame or guilt. And it's just a huge weight off. And, I mean, not all of these amends go over swimmingly. Some of them just don't go over well at all. But we don't have that control over the outcome, do we? So, but it's still important for us to at least clean up our side of the street, whether or not the person on the other side is willing to receive us.
And it's not a process that occurs in isolation. There is a huge build up to this, isn't there? This
Well,
step
yeah,
nine. The processes of step nine actually start multiple steps previously. Talk us through the context.
right. Well, the steps um, are supposed to be taken in order for a reason, because they do build on each other.
Hmm.
It's like scaffolding. The steps are scaffolding. So, step one, I mean, if you don't get step one 100% right, meaning quit using drugs and drinking, you really can't move on to the other steps because you don't have that foundation yet at all. But once you
Hmm.
have somewhat of a foundation of being clean and sober, then, okay, believing in a power greater than ourselves, and then trusting in someone outside of ourselves, and then making an inventory, and then discussing that inventory of our behavior and past actions to a sponsor or therapist, and then having the belief that another person besides ourselves and a higher power can help us be willing to make these amends. And then the eighth step, writing them down. And then the ninth step, writing, who we've harmed down. And then the ninth step, including ourselves at the top of that list. And then the
Hmm.
ninth step, making those amends. So there is
Hmm.
definitely an order. Uh, I do have, there's different sponsees I worked with who are like, well, I like that step. No, I definitely don't like that one. I think I'm going to just do this one. And unfortunately, a lot of times people relapse when they don't go through the entire process. It's not like a buffet where you pick and choose. It's not how it
Yeah.
works.
Yeah.
Yeah.
So it's predicated on a large amount of work previously, and it's also specifically predicated on making the list, because we've discussed in previous episodes how the thought of having to go through making amends inhibits people making the list. So if you can get over the issues around making the list, then you approach the ninth step. And it's what I'm hearing is that it's not something that happens quickly. The ninth step may take many years to complete, in terms of actually making amends to all the people that you've hurt or wronged. It may take a long time. It may take years.
Yes, it may take years in the sense of, so with the eighth step, you usually write down the names that, it's not so hard to make certain amends to. You don't feel it would be such a struggle. But some people on the list, yeah, we maybe have a total block, or just don't feel we could ever make amends, or don't want to.
Hmm.
So those people would probably take a long time.
Yeah,
Um, but uh, other people, it depends.
sure.
Mhm.
So let's talk about the role of willingness. I mean, really, you're going through a very challenging process. You have to be willing to do it, because there has to be a benefit to you. And we've discussed the benefit, which is it's part of the healing process, it's part of the recovery process. But the willingness to do it actually starts previously, doesn't it? The willingness starts with the previous steps. How do you sustain that willingness through the entire process?
I think so. For I myself sustain the willingness by talking about it in the rooms, by talking to my therapist, by talking to other people. Um, Also about it's I think where people have a big block, I know myself included, is um, you know, when I think about, or I need to make amends to this person, a lot of times people will say, yeah, but they did this, this, and that to me.
Mm,
And so like, for example, today would be my father's 92nd birthday. And I put that man through living hell when I was a teenager, but I really had a struggle making amends, because I had a book full of things that happened in my family growing up that I felt he totally dropped the ball, and even participated in not being the best father he could be. But a couple of years before he died, I decided to make an amends, and I'm so glad I did. I just focused on, he didn't, come out and say, "Oh, I'm sorry, I effed up too." And I didn't really think that would come out of his mouth anyway, but I felt better making amends. And I knew that if he had died before making that amends, I would regret that. So I'm glad that I did. But
So
it
it
took
took you how many years? How many
uh
years of sobriety did it take for you to make that particular amends?
probably 38 years.
38 years. It's not a
Yeah.
one-off. It's not a
No,
one-off quick process, is it?
no. Because I had all this resentment, and I mean, sometimes I mean, I still have a little, well, some, but yeah, I had a lot of resentment, and then even after I got clean and sober, uh, he hadn't changed, even though I had changed. So I mean, it was just like we'd go to a restaurant and try to talk. I try to talk to him about things growing up, and we'd just clear out the restaurant. I mean, people would just. I remember one time we looked around, we're like, "Where is everybody?" We didn't realize we had been yelling and screaming at each other. So we always kind of had a contentious relationship, but
Hmm.
in the end, I'm really glad I made amends,
And
and
that's something to focus on, isn't it? That in the end, you are really glad that it happens. And notwithstanding how difficult it is, and notwithstanding how long it took you, you were glad. So in terms of a message of hope, what happened? What was the benefit for you having done this process?
the benefit was, or the benefit is, um, having compassion. Um, the benefit is, at least with this particular men's, was um, seeing my father more as a person and being a parent myself. I know I wouldn't get the Parent of the Year award either. Um, so having forgiveness of him was also in a way helping to forgive me and my mistakes as a parent to my daughter, and it 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 by making amends, it helps open us to other people. By not carrying that guilt and shame, we're not as closed off, and so we're more open, and then people are more open to us.
It seems to me that whilst the step 9 is couched in language of making amends to such people wherever possible, i.e., for the benefit of others, really, one of the key messages, it seems, is that the benefit is actually internal. It's also for the benefit of the person making the amends on so many levels, including recovery.
Right. Yeah. To me, it's a win-win on both sides.
Yeah,
Um,
yeah,
although, again, there are some people you're going to make amends to that are still not going to be happy with you and
mm,
what happened or your behavior. And I try to warn people to be prepared for that. Not everyone's going to welcome you with open arms. It may not go down the way you want at all. And
yeah,
that's why I think this step, it's good. It's like down the line, because then hopefully you have some sobriety under your belt. And because I've seen people relapse when an amends went totally awry. Um, so it's important to have some sobriety under your belt.
yeah.
Yeah.
All right, Laura, we've run out of time, but I want to thank you for your wisdom as usual. And I look forward to chatting with you again very soon. Thank you.
Great. Thank you, Fergal, for having me on the show.
That's all for today, folks. My name's Dr. Fergal Armstrong, and this has been Cracking Addiction.